Hey, hello everyone, and welcome to the Bayer4 Health podcast, where we talk about health, wellness, and everything in between. It is said that the groundwork for all happiness lies in good health. I'm your host Parikshit Chindhade, and today we are delving on a topic that doesn't get much attention as it should: chronic kidney disease. To help us navigate this topic, we have Dr. Georgi Abraham, Academic Director and Senior Consultant Nephrologist at MGM Healthcare Private Limited, Chennai, and Dr. Illangopan Virappan, Chief Nephrologist at KG Hospital and PG Institute, Coimbatore. Welcome to the show, Dr. Abraham and Dr. Illangopan. Let's start with some perspective. Dr. Abraham, how common is kidney disease and why should people be more aware of it?
I am Dr. Georgi Abraham. Thank you for that very important question. The prevalence of chronic kidney disease in India, we have published in a series which was in Lancet in 2016. It is about 17.2%. Most of the kidney disease in this country, the cause is diabetic kidney disease, followed by other kidney diseases. So it is a issue and which is very significant, and this has to be tackled. And what is chronic kidney disease? Just for the common people to understand, it is a scar in the kidney, slowly progressive, often asymptomatic and irreversible. Or if you have kidney functions less than 60 cc per minute. What is the 60 cc is measurement of the kidney function is by a metric called glomerular filtration rate. If the glomerular filtration rate is persistently less than 60 cc per minute for more than 3 months, we call it as chronic kidney disease.
Right. Thank you, Dr. Abraham, for that quick comment. Now, I would like to pass on to Dr. Ilangovan. Dr. Ilangovan, most people know that kidneys filter waste, but clearly, they do much more than that. So, could you explain why the kidneys are essential for overall health?
Yeah. So kidneys is one of the vital organs in the body. We all know that, and waste disposal is one of the key jobs the kidney does. But it does quite a lot of other jobs like keeping your blood pressure regulated. It's one of the key organs. That is why most patients who have kidney disease also have very severe hypertension, which is very difficult to control with especially one drug. And it's a very key organ in maintaining the fluid and electrolytes. You drink 500 ml, your body is okay. You drink 5 liters, the body is okay. So kidney is the epicenter for a good health for whatever amount of salt or water we take. And the food we eat also produces a lot of acid status in the body. And kidney is one vital organ which neutralizes this acid. It also a key organ when it comes to hormones in the body. The key hormones being erythropoietin, which is very vital for hemoglobin. That is why people with kidney disease tend to have low hemoglobin. And also the sunshine vitamin, the vitamin D, gets activated majorly in the kidney and the liver. So these are some of the function. And also it's very critical in conserving the salt what we eat, the calcium, magnesium, potassium, which are all key elements for the day-to-day functioning of every single cell and the human body. So when we are looking at a dysfunctional kidney, we are looking at a whole lot of problems in addition to passing urine and clearing some toxins.
Wow, I think the context that you have said is quite startling because most people are not really aware of kidney until something goes wrong. So clearly, it's a very good insight, and I think for people who are listening to the podcast, I think please do keep this in mind. Whatever Dr. Langovan has said. That brings me to the next question for Dr. Abraham. So, sir, who is most vulnerable to develop a kidney disease?
Thank you for that question. As we have an enormous burden of kidney disease in the most populous country in the world, the people who are prone to kidney disease are those with diabetes, those with cardiovascular disease, which also includes high blood pressure, those with family history of kidney disease, those who have been taking alternate medicines or painkillers for a long time, and those who had previously had acute kidney injury, and this needs to be followed up. These are the 5 categories of people who should be screened for kidney disease and the screening can easily be done very simple by a blood test called creatinine level in the blood, and by a urine examination, routine urine examination, which will tell you whether you have protein leak in the urine, abnormal blood cells in the urine, whether you have glucose in the urine, or some other abnormalities. So these are the two important vital tests to find out whether you have kidney disease, including a blood pressure measurement.
Wow, I think Dr. Abram, what I could sense from your talk is that, of course, kidney health cannot really function in isolation. So that essentially brings me to my next question for Dr. Illangopan. So, sir, is there any specific link between kidney disease, diabetes, and cardiovascular conditions? And can you quickly explain, so in a layman's language, that how all three are interconnected?
Yeah, so the diseases, what you say, like diabetes, hypertension, kidney disease, no, if you have to connect all together, you can call them as metabolic disorder. As Dr. Georgi sir rightly pointed out, the number one cause of kidney disease in the world is diabetes. So we are looking at a metabolic disease. A metabolic disease, like meaning people lifestyle disease. So these days, our lifestyles have tremendously changed. We are more sedentary. We are eating processed food. So in essence, kidney disease also one of the spectrum of diseases like diabetes, hypertension is a kind of lifestyle disease. But in other way, if you look at like diabetes, hypertension, no, they do involve the blood vessels in the body. The blood vessels are present all over the body. So the blood vessels are there in the heart, they are there in the kidney, they are in the brain. So a disease which affects blood vessels like diabetes and hypertension tend to involve organs like kidney and the heart. So that way there is a common connection. And also, like people with like obesity tend to have the similar kidney damage like a patient who have diabetes. And the insulin resistance also plays a big role in patients with hypertension. So basically, these are all very well connected. So much so, like in a patient with diabetic kidney disease, secondary to diabetes, there is a 40% or 50% excessive uh, risk of mortality. If they have a heart disease and a kidney disease, especially a common denominator being diabetes, they tend to have much more problems as against somebody who's not a diabetic and at the same time has kidney disease. So they do have an interplay, very complex ones. And also in patients who have advanced kidney damages, there is a release of toxins and hormones, which also stiffens the blood vessels. It worsens the heart failure, triggers a lot of arrhythmia. So that way they are all interconnected. And like heart is only few inches away from the kidney. And when there's a heart dysfunction or a failing heart, it could produce enormous back pressure on the organs like the kidney. And that way, thereby also it affects. And the hypertension, I would say, is a major catalyst. You have diabetes and hypertension, the diabetic damages worsens. If you have hypertension and kidney disease, the kidney damages worsen. If you have a heart disease and hypertension, the heart disease worsens. So these are all like, it is like throwing oil on fire. So you have one disease and you have one more, then it's not an addition, it's multiplication. So that's how they are well connected. So having one disease, I would suggest that you are supposed to screen for other diseases. Like if somebody has diabetes, they're more likely to develop hypertension and kidney disease. Like if I have to keep it short, like people with diabetes have 40 to 50%, 50% of them tend to have some form of kidney disease in their lifetime. And 10 to 15 of them can have an advanced kidney damage in their lifetime. So that's how connected they are.
Right. I think amazing, sir. The kind of insights that you have provided, they are really valuable because for a layman, of course, when he looks at kidney disease and or diabetes or CV conditions, one always tends to look at them in isolation. But I think the point that you've made that all the three are interconnected is something that is really important for a person to know. So that brings me to the next question for Dr. Abram. So, Dr. Abram, it is always said that prevention is better than cure. So, what are some lifestyle changes that a person can bring into himself so that he stays away from kidney disease?
Uh, the lifestyle modifications one can undertake are the most important thing is control of diabetes with diet and medications. Exercise. It is well reported that exercise helps in weight reduction, feeling increase tolerance, and also at the same time it slows down chronic kidney disease. So it is very important that people should exercise. You don't have to go to a gym and do exercise. You can do simple walking. Maybe I do that at this geriatric age group. I walk at least 35 to 45 minutes, 3 times a week, and in the road, that is sufficient enough. And you don't have to do heavy physical exercise as you grow old. The next most important thing is avoiding uh, food substances which can increase your weight. So, food diary is very important so that it will help you in reducing your blood pressure by reducing the salt content in the food, and also by controlling the diabetes and controlling the fat in the body. The next most important thing is reduction in salt intake. Salt is considered to be one of the most important electrolytes in the body, which is responsible for maintaining the blood pressure. Those who have slightly high blood pressure, that's more than 130 to 135 systolic blood pressure, they should definitely reduce their salt intake. The WHO recommendations for salt intake is 5 grams per day. However, they have rewritten that again and said that it should be less than that. So people ordinarily do not know that when they eat the food, it has sodium in that, and adding more salt to that to make it more tasty, this can have an impact on your overall health. The next thing is that you need to avoid alternative medications. You never know about the how good and bad are alternative medication. For example, I just saw a young man, 27-year-old, who is working in one of the TV companies here, and he had kidney disease nearly 2 years ago. His serum creatinine was 1.5 milligram, which is high for him, and urine had protein. And he just neglected that. And probably the doctors were not told about it. And then, in about 4 months ago, he took some homeopathic medications for what we do not know. And he comes with severe kidney failure. And they did a biopsy on his kidney. And this particular gentleman had a kidney condition called IgA nephropathy. And this IgA nephropathy was happening for quite some time. And then on top of that, he went and took some alternative medicines, which made it worse. He is now on dialysis. What next? The only thing is that he has to either continue on dialysis or go for a transplant. So be always cautious about taking alternative medicines, because these can harm your body when you have a pre-existing kidney disease or heart disease. The next most important thing is that if you have a history of a previous kidney attack or a kidney injury, follow up your kidney function with your nephrologist at regular intervals, because we have different stages of kidney disease, stage 1 to stage 5. Stage 1 is the first, where you have nearly normal kidney function. As it advances to stage 5, which is the kidney function with regard to both kidneys is less than 15% or 15 ml per minute. So, as the kidney disease advances, you have to be very careful in using medications, especially painkillers, alternative medications, and other things what you do, because these hits, I call it as hits, these hits can make the kidney function worse. So one need to be followed up regularly with regard to your kidney function when you have early kidney disease. And the most important other things we have to do is control your blood pressure. If with lifestyle, if you cannot control your blood pressure, you have to go on medications. And diabetes, because lifestyle will help in diabetic controlling the blood glucose level. But now there are effective medications, new medications, which are very effective in controlling the blood pressure, in protecting the kidney, in reducing your lipid levels, in reducing your salt in the body, and also protecting the heart. So it may be worthwhile following up with the doctor to see that whether you require these new medications, which are called as SGLT2 inhibitors, and also the other one is called as finerenone, which are all very effective drugs in slowing down the progression of kidney disease.
Right. So, Dr. Avram, what you've said is really these are golden words. And, for a layman who is listening, we always tend to believe that chronic kidney disease is something which is a very silent condition. But, as you have said, the consequences can be really bad. And thank you for suggesting the way outs. And essentially, what you've said is basic lifestyle modification, adherence to a very normal diet, taking good exercise, taking care of your health can all prevent the development of chronic kidney disease. So that brings me to the final segment of our session. Dr. Ilangovan, in your opinion, what are the few important takeaways that a listener should carry with him when he listens to this podcast?
Yeah, so kidney disease has come to a point that it is becoming one of the top five killers in the world. So it's going towards that direction. So and it's affecting almost 10% of the world population. So it's estimated around 850 million population do have kidney disease in some form, and that's brings to around 10% of the world's population. So basically, we're looking at a huge burden. And like diabetes and hypertension, this is being a silent killer. So the listeners, what they should be doing is first you have to see whether you fall into the high risk categories, like what Dr. Georgi sir has spoken about. Patient with hypertension, very high hypertension on many years, not getting control. Diabetes, people with family history of kidney disease, and people who are frequently taking over-the-counter pills. So these high obese people, so these high-risk patients should mandatorily get themselves screened for kidney disease because the risk of them having kidney disease is definitely higher than a population average, we call it. So more than 20%, I would say. So these people should get, that's number one, because these days, like drugs like SGLT inhibitors, Pindrinone, like sir was can actually retard or even sometimes reverse early kidney damages. So if you come to the doctor in an early stage, we can even cure it, even if it's a lifestyle disease. We all know like lifestyle disease is difficult to reverse, but the technologies are available now, like can even reverse and retard major. The two key things, the learning they have to do, and prevention is the key. As being a most of the more than 50% of the kidney disease being a lifestyle disease, walk every day, most days a week. Keep an eye on your diet. Have a nutritious diet. Manage your stress levels. So these go along. Well, these cannot be measured even. So they can significantly reduce the incidence of any disease. Forget about kidney disease. And so, in summary, regular checkups, especially if you follow in the high risk group, and also learning, knowing more about it, and then trying to spread the awareness inside your own family, because I'm sure every family has a diabetes and hypertension patient now, and kidney disease also is going in the same direction. So, spread the awareness, at least you be helpful and be useful with to your own family members. Spread this so that you don't have to suffer, and or any of your family members have to go through kidney disease.
Wow. Thank you, Dr. Illangovan and Dr. Abram. I think what you've said is really apt, and I think it cannot be said any better. And since the World Kidney Day also is coming up, I think the messages that you have shared become more relevant, as we approach the World Kidney Day. So thank you, Dr. Abram and Dr. Illangovan, for sharing these amazing insights. And to our listeners who are listening to this podcast, if you have found some value with this episode, do share it with your loved ones. And of course, stay proactive with your kidney health, and we'll catch you up next time. So until then, take care and stay healthy. And I once again thank Dr. Abraham and Dr. Ilangovan for taking time out and joining us for this podcast. We hope to catch up with you very soon. So thank you. So to our listeners who are listening to this program, please like our Facebook page, Bear for Health. You can also find us on YouTube and Instagram. Thank you.